My name is Stephen Dobson, so I'm now CIO for an organisation called 1LSC. So 1LSC is bringing together the digital from all of our 4 acute trusts into one organisation.
One of the big challenges that nobody really talks about is information sharing and how we can best do that across a region.
Currently, healthcare data is stored in multiple different locations, be it primary care, secondary care, social care. And because it's fragmented, it becomes difficult to get useful insights that will then drive population health. So NHS England are driving this program called the Data for R&D program. And the idea is that you come together as a region, for instance the Northwest. We build a single secure environment where we can pull data from multiple providers. And the data is anonymized or de-identified to remove any personally identifiable information.
What we're trying to do is unify multiple health systems. You'll have electronic patient records, you'll have prescribing data, you'll have all of your pathology and blood tests, and potentially microbiology, maybe x-rays. All of these are held on different systems.
Data is collected pretty much every time a patient touches the NHS on their entire journey. So within an acute hospital, right from the start all the way through your visit, at every one of your outpatient appointments, different pieces of data are being collected all the time. At the moment there's lots of duplication, particularly across the acute trusts, as they all have to do similar things in slightly different ways. So hopefully we can get rid of some of that complexity, we can improve our data collection, improve our data quality, and start to do some improved things with better efficiency across the entire ICS.
So one of the analogies that we always talk about is if you got in a car and went down the M1 towards London from the north and you're in an accident and the ambulance that then came and picked you up wasn't aware that you had various issues with your health. So it could be diabetes, it could be a heart issue, it could be something that you're allergic to. And it's very difficult for them to understand what your medical history is. So on that basis, data sharing becomes even more important.
We understand that data is valuable and it's about turning that data into actionable knowledge so that they can kind of provide better and healthier communities and better patient outcomes.
Lancashire and South Cumbria have heavily invested in Microsoft technology, amongst others, and they chose the Microsoft platform as the best place to deploy these workloads. Phoenix is Microsoft's leading public sector partner in the UK, obviously endorsed that decision, and we're experts in helping them to move to that platform and take advantage of all the different infrastructure, platform and data services that are at their fingertips throughout the deployment of the project. And the secure nature of the Microsoft Cloud by design really helped them drive the project forward.
From the secure data environment perspective, data is being used to save lives in looking at patients that are at increased risks, where interventions to improve health and target treatments can be put in place. It's helping to develop new drug and therapy treatments and of course new digital devices, for example the blood glucose monitoring systems. The additional benefits of those types of systems is it allows patients to manage their own chronic conditions.
I think Phoenix have this really wonderful relationship and a successful track record with other NHS trusts and blue chip companies in delivering what we wanted to do.
Personally, working on this project has been amazing to kind of see the outcome that they've been able to achieve by using all this data across the region to be able to interpret that and provide ultimately better patient care.
Phoenix and Microsoft helped us design a cloud-ready Lancashire-wide platform that can ingest not only data but systems or anything else you want to launch in the cloud. They helped us mesh together traditional on-premise design into the cloud for us to use for any purpose, which was fantastic. And I think being part of that pioneering work, I think you'll only look back probably in a couple of years and think, I was part of this.
With the SDE in place now, Lancashire and South Cumbria are set to benefit from the investments that organisations such as Microsoft are making in artificial intelligence, bringing those capabilities to the SDE, democratising data to serve its patients, citizens further in the future. It's such an exciting time. We have this convergence of the two worlds of healthcare and technology moving at pace to deliver great outcomes.
The work we did with Phoenix and Microsoft at Lancashire Teaching Hospitals was the primary driver for where Lancashire South Cumbria Secure Data Environment is today. That work was foundational, if you like. That was the absolute starting point on this journey. And it doesn't, it's been only 3 years from that journey, but without that piece of work, we wouldn't be where we are today.